Well, good morning. Welcome. I guess it's morning where I am. I'm not sure if you're watching this in the morning or not, but welcome back to 450 in Module 5. So the topics this week, alcohol and tobacco. A couple of years ago, I want to start with a little story. A couple of years ago, in one of the employee health programs that I work with, I was working with a gal. She was at the time in her upper 50s, and she just started the program, and her job was involved a lot of PR. So there were a lot of opportunities to go to entertain visitors and friends of the university, and so it involved social time, drinking, eating, that type of thing. So we talked a lot about alcohol consumption, and it wasn't wasn't in a situation of being, with alcoholism or anything like that. But there was a lot of social consumption, and more than what would be considered moderate consumption, and so that was some of our conversations. What does that mean? As far as calorie consumption, but what does it mean as far as detriments for health? And sometime down the road, and it was within a year or so, this person unfortunately developed breast cancer, and at the time I was a little surprised, I guess, just by the nature of the diagnosis, and her lifestyle seemed to be healthy and whatnot. And so I started digging a little bit deeper, and was disappointed in myself because I didn't take the steps at the time that were needed because of her frequent alcohol consumption to try to mitigate her risk for cancer, for breast cancer. And as you'll read in the book, women especially who drink more than moderate amounts of alcohol, and especially if they have genetic risk for breast cancer, a particularly higher risk because of the alcohol consumption in its relation to folate absorption. And so the reason I'm telling you this story is because I think about it all the time now when I hear women or men, but especially women, who drink more than moderate amounts of alcohol, that there should be some, if the consumption can't be decreased for whatever reason, that at minimum a supplement of folic acid should be in order. And as you read in the book, there's some good research around supplementing with just 600 micrograms to help with that absorption and decrease that risk for breast cancer. And so I tell you that because you just don't hear those kinds of things. I didn't know about it before. That's why I think the disappointment part came. Oh, I should finish the story. Long story short, she's doing great. She's a breast cancer survivor, and she's doing wonderful in all parts of her lifestyle. So the story has a happy ending, but it was a great lesson for me in that I mainstream literature doesn't really talk about this component. When you talk about cancer and alcohol, you hear, well, you got higher risk for greater consumption, that kind of thing. But sometimes that's white noise until you can apply it to a particular individual in particular situations. So that's one of the things that you'll read in the chapter this week. The other point that I wanted to make was alcohol consumption is somewhat controversial because on one hand it has benefits, and on the other hand it has risks. And of course we just talked about one of the risks. But there's quite a bit of literature to support the benefits of moderate or less than moderate alcohol consumption, especially in particular populations that might be at, when you look at cardiovascular risk, might be a slightly higher risk for cardiovascular disease, especially if they're older and advanced in age. When you get past 60-ish, it looks like if there are no other reasons to not drink alcohol, then it may have some protective benefits. There's been some controversy over the years about why is this, because does it show up because someone may have other factors that are not being considered that put them at a lower risk or lowering their risk for heart disease, like maybe they can afford to take the medications for cardiovascular risk, blood pressure, cholesterol, that type of thing. Simply their other lifestyle, maybe they exercise or maybe they eat better, that aren't being considered. Those have kind of died down in the last couple of years because I think the literature is pretty clear now that in certain populations, alcohol does have a cardioprotective benefit. But if you look at this, really is unproven though in younger adults, 20s, 30s, 40s, is still a big question mark out there. So sometimes I'll get the question, well, I drink to protect my heart, and it's a 30-something person or a 40-something person, and so I have to kind of temper that by saying we really don't know if it's doing anything for you beneficial. If you were 65, 70 years old, and you were saying this to me, I'd say, yeah, there's probably pretty good evidence to support what you're doing. But at the younger years, there really isn't enough solid evidence to say that the benefits outweigh the risk. So you kind of have to balance that when you're working with that alcohol risk benefit, because it is unique compared to the other components that we talk about in this course. Sleep being another one that is kind of falls on either side of too much or too little. But certainly things like managing stress and exercising and eating healthy, those kinds of things, largely the benefit outweighs everything on that side. So so it's kind of unique. Alcohol is unique in that sense. And then the other topic of tobacco, there isn't anything good about tobacco. Just avoidance of tobacco is a recommendation. So that's pretty straightforward in that case too. So at any rate, the two topics for this module, the alcohol and tobacco, sometimes are white noise. People aren't really all that interested because we hear about tobacco abstinence or tobacco cessation so often, and we've heard about it for years, that sometimes people aren't all that interested. And in some pockets, the incidence of tobacco use, particularly smoking use, is going down in some cases, so we're making some headway. But in other cases, they're not, and it's still very prevalent, still very significant, still need to have a lot of attention paid to it. It's a very difficult, nicotine addiction is very difficult to overcome, and that's why the chapter really steers towards, it certainly does not even come close to doing it justice as far as the topic, and so it just scrapes the surface. But it gives you resources to say, if you're interested, let's go to this place and see if we can find some more resources for it to help further education in that, and that's part of what that chapter is about. And so I want you to, if you get a chance, to go to those sources and just check them out, so you know what is available to you as far as resources. There are folks who just do tobacco cessation. We have one or two here on campus in particular. This is what they do for a full-time job is tobacco cessation. So there are certifications in that, tobacco cessation specialists, for instance, that folks specialize. In particular, these folks are employed in employee health settings, like here at Creighton, because there is such a direct correlation between smokers and poor quality of life, poor job performance, increased health expenditures, and so it makes sense for employers to hire a tobacco cessation specialist and to have policies at the workplace that don't allow smoking or tobacco use at all on the premises of the facility. We have that here at Creighton. It was passed, we're probably going on almost 10 years now, where tobacco isn't allowed on campus at any place, and so it's a great move forward. It's more acceptable now than when companies tried to do this 15, 20 years ago. At any rate, if you have any questions about the chapters, certainly let me know. I'm looking forward to reading your posts. They've been fantastic, the discussion posts. I'm really happy with how those are going, and the insight and the depth, and the comments that, back and forth to your classmates has been really great. So keep up the great work, and we'll talk to you again soon. Thanks.